Γεια σας και καλώς ήλθατε στο euronews. Με το σταγονόμετρο μπαίνει στη λωρίδα της Γάζας η ανθρωπιστική βοήθεια μετά την 7η Οκτωβρίου και την έναρξη της νέας ισραηλινο-παλαιστινιακής σύραξης. Οι ανάγκες των αμάχων είναι μεγάλες, σε νερό και τρόφιμα αλλά και καύσιμα, τα οποία είναι απαραίτητα για να λειτουργούν τα νοσοκομεία. Για την εκκένωση του νοσοκομείου Αλ Κουντς που έχουν ζητήσει οι Ισραηλινοί, αλλά και για τους ισχυρισμούς του Τελ Αβίβ ότι υπάρχουν μέλη της Χαμάς που επιτίθενται μέσα από το νοσοκομείο, συζητούμε με την εκπρόσωπο της Παλαιστινιακής Ερυθράς Ημισέληνου, Hello and thank you for joining us. Right now you are in Ramallah, but your organization operates on the ground in Gaza Strip. The humanitarian aid reaching Gazans the last weeks, from what we understand, is like a drop in the ocean. Please give us a picture of the humanitarian catastrophe that is unfolding right now and of the conditions the Gazans live under.
The Palestinian Red Crescent is the lead emergency medical service provider in the occupied Palestinian territory, so in the West Bank and in Gaza Strip. Since the beginning of the escalation for over 31 days, Palestinian Red Crescent teams are working in the ground around the clock, trying to deal with this increasing number of casualties. There is no safe place in Gaza. Palestinian parents feel helpless, vulnerable. They can't protect themselves or their families. There are continuous bombardments that is taking place all day and night. There is no safe place. And with this, you're talking about very lacking food, lacking water, no electricity, no medicine. There is literally nothing. The amount of suffering nobody can handle because people are literally dying when I already speechless. I feel I have lost the words that can reflect the situation on the ground. People now are just seeking refugee any place, whether in schools or in hospitals, and they are even there with no food and water. Hospitals have turned into and not only places for injured people and patients. They are now sheltering thousands of people who have no place to go to. As you know, Israel forced people in Gaza and the north to evacuate themselves to the south. Israel forcing people to do that under intense bombardments. So there is no humanitarian corridor to allow the civilians to take in order to evacuate themselves to the south. There is also no transportation, no fuel, and the roads are extremely dangerous and complete destruction of the roads and infrastructure. So people, they don't even know how to evacuate themselves. So either they are staying inside their homes under intense bombardments, or they just seek refuge to the nearest hospitals or schools. So now in Gaza and the north, there is still hundreds of thousands of civilians who are living with no food, no water, no electricity, with nothing. They even are lying on hospitals corridor. For example, the Al Quds hospital, which is run by the Palestinian Red Crescent, we have inside the hospital 14,000 civilians who are currently taking shelter inside the hospital. They are lying in hospital's corridor, sleeping there. Some of them, they even sleep outside in the front door of the hospital. Most of them are children and women. For the past days, we have been under intense bombardments in the surrounding area of the hospital. Literally day and night, ongoing bombardments, which has resulted in complete destruction of most buildings who are in the surrounding area of the hospital. You can't imagine the horror and fear that those displaced people who have no place to go to and they just seek refuge to the hospital are witnessing every single hour, and they simply don't have any place to go to.
The Israelis have asked for the evacuation of Al Quds hospital, which you just mentioned. You said 14,000 people that are not injured have taken shelter inside the hospital. How many people injured people are being treated in this hospital? And is there any way you can evacuate these people?
we have inside the hospital around 500 patients, many of them in the intensive care unit. They are connected to life support machines. There's babies in incubators. There is no way we can evacuate them safely. Evacuating our patients means killing them. We have also 100 staff along with 14,000 civilians who are most of them children and women. And basically we don't have the means to evacuate them. We have announced this repeatedly. And as you know, Gaza is under intense bombardments. It's not safe even to evacuate. And the question is, where should we evacuate? Because basically all hospitals now are collapsing and they are already running out of fuel, suffering from the extreme shortage of medical supplies and medicine. So basically there is no other hospital that could receive our patients, and there is no other place that is equipped and ready to transfer our hospital to it. It's simply an impossible mission that no way we can do it. And this is not only our opinion, even the WHO has announced that evacuation orders against hospitals are impossible to implement. They constitute a death penalty for patients. The second thing, as I told you, there is still inside Gaza and the north hundreds of thousands of people who don't have any place to go to. So evacuating all the hospitals from Gaza and the north, that means leaving hundreds of thousands under the threat of being killed at any second because of the intense bombardments, without even finding a hospital to receive them or give them a treatment. So the situation is just so much hard, and doctors, nurses should not be put in this position to choose whether you are being bombed under intense bombardments all day and night or just leave your patients behind and go. This should not be a choice. Hospitals, healthcare workers, healthcare personnel should be protected according to international humanitarian law.
So let's make it clear. If a person gets wounded right now in the Gaza Strip or in the city of Gaza specifically and needs medical attention, what are his chances of survival?
Hundreds of cases, when they get into the hospital, they have to wait in hospital's corridor until they get the chance to be treated, because we are witnessing a high number of casualties at some point, and absolutely many have lost their lives without getting the treatment, because even now hospitals are overwhelmed. They have work more than full capacity. There is no empty beds. So people and injured people are getting treated at the ground in hospitals corridor, and they simply have to wait until the doctors and nurses can be able to take care of them. This is along with the extreme shortage of medical supplies and medicine, as well as running out of fuel. So all hospitals in Gaza now are under the threat of being shut down at any second because running out of fuel. Around 16 hospitals out of 35 have already went out of service, either due to bombardment or because running out of fuel and medical supplies. Up to this moment, the humanitarian aid that is get into Gaza is, as you just said, is just a drop in the ocean. It doesn't fulfill the needs of over 2 million people who are living in hunger, and they are in need for food, water, and medicine. Does not also fulfill the need of all hospitals in Gaza who are now collapsing, having extreme shortage of medical supplies and medicine, as well as fuel. Most importantly, fuel up to this moment has not been allowed to get into Gaza because Israel refused to allow the entry of fuel. Although all hospitals are relying completely on backup generators to have electricity. So basically, without electricity, all hospitals were shut down. Also, we have children who are babies who are in incubators. We have injured people who are connected to life support machines. When the electricity will be completely cut down, that means they will lose their life. It's just an alarming condition that hospitals now are witnessing.
Israel claims that there are Hamas members, militants that are attacking, shooting Israeli soldiers from inside the hospitals, and they have even showed pictures of, as they claim, Hamas members firing rockets from inside hospitals. How do you comment?
My comment is the Palestine Red Crescent have Al Quds Hospital, and we are, as an international organization, a member of the Red Cross and Red Crescent movement. And Al Quds Hospital is run by the Palestine Red Crescent, as I just said. Our organization believes in the same principles: humanity, impartiality, and neutrality. Could Israel also answer me why it is threatening Al Quds Hospital with evacuation orders because it is going to be bombarded? Why Israel, for over last week, its target Al Quds Hospital in the surrounding area of Al Quds Hospital, which has resulted in injuries between the patients as well as in injuries between the displaced peoples who are taking shelter inside the hospital? Is there an answer for my question? Al Quds Hospital was completely burned out, bombed in 2009, and it took us 12 years until we rebuilt it. And now, as an international organization, we are under the threat of being bombed, Al Quds Hospital, because Israel is threatening us, and also there is continuous bombardments that is taking place all over the hospital. I think Israel always tried to find justifications for implementing several war crimes. There should not be hospitals, healthcare workers, ambulances, and paramedics should not be a target. They should be protected under the international humanitarian law. There is no justification for targeting hospitals or ambulances. I have other question too. Up to this moment, 4 colleagues were killed. 4 paramedics who are working with the Palestine Red Crescent were killed while they were on duty, trying to save other people's life in Gaza. 21 colleagues were injured while they were also on duty. 8 ambulances went out of service due to Israeli bombardments. 6 other ambulances have severe damages because of Israeli bombardments. 4 buildings related to the Palestine Red Crescent went out of service due to bombardments that is taking place very close to those buildings. We're talking about the Emergency Medical Service Center in Gaza, the Emergency Medical Center in North Gaza, and the central warehouses for the Palestine Red Crescent. They all went out of service due to Israeli attacks. These attacks should be stopped. It's not acceptable at all to attack civilians, healthcare workers, hospitals, and ambulances.
I understand how difficult the situation is. Are there injured people that are being transferred to Egypt? And what is the procedure for this? Who decides what? I mean, who gets to be transferred or not?
So basically, the Ministry of Health and the Egyptian authorities are coordinating to allow the entry of a number of injured people to Gaza to be treated there. The conditions, it's not very clear, but as far as we know, Israel has to approve the names of those who are allowed to be transferred to get treatment in Egypt. For example, one of my colleagues told me that a boy who is critically injured was supposed to go transported to get treatment in Egypt. However, Israel authorities gave approval for the son, for the boy, but not for his dad. So the dad has to go back. He turned back, sadly. He was his son because he simply can't leave his son, go to Egypt alone. So they had both to go back to Gaza without getting the treatment. And basically, as you know, 2 days ago, Israel has attacked the ambulance convoy where they were trying to transport injured people from Gaza to the south, to Rafah, to be transported to Egypt. So from that time, the transporting of the injured have been stopped because ambulances now under the threat of being targeted again. At that day, Israel target the ambulances convoy with airstrike, and then after they were trying to go back again to the hospital, once they arrive at Shifa hospital, another airstrike took place in front of the ambulances, which has resulted in they were basically around 5 ambulances for the ministry, 4 for the Ministry of Health, and one of them is for the Palestine Red Crescent. And when the ambulance was exactly in front of Al-Shifa hospital, another bombardment happened, which has resulted in a damage for the ambulance, which went out of service. And by miracle, both paramedics have some injuries, but they were fine. And there was inside our ambulance a woman which she is in 30s, and she is an ICU patient. She was supposed to be transported to Egypt to get treatment, but unfortunately we couldn't, because we have witnessed 2 attacks, 2 Israeli airstrike against ambulances who were trying to transport those critically injured patients to Rafah to go to get treatment in Egypt.
Let's discuss a little bit the immediate dangers for the children. Can they find food, water, shelter? And what happens to those who lose their children? Is there any procedure for this, or they just come to the hospital and ask for help?
4,800 children have been killed up to this moment. More than 1,270 children are still missing under the rubble. Children now under intense bombardments all day and night. They are lacking food, water, electricity, medicine, everything. And on top of that, without electricity, you can't imagine the horror and fear they are living when it's completely dark and the only sound they hear is just the sound of bombardments. This should be stopped. Innocent civilians should be protected according to the international humanitarian law. Since the beginning of the escalation, children, innocent civilians are paying the cost of this continuous escalation. When we talk about 10,000 who were killed since the beginning of the escalation, 70% of them are children, women, and elderly people. This human suffering should be stopped, and this international community should intervene immediately to save the lives of children who have been under intense bombardment and horror for the past 30 days.
You spoke a little bit about the impact on children. Let's discuss a little bit in general. What is the impact of this horrific situation on both adults and children right now?
Being under intense bombardments all day and night, losing your loved ones, being forcibly transferred from your home, and even now sheltering in a school or hospital is absolutely had a very negative impact on mental health of over 2 million civilians who are currently in Gaza. Even our paramedics who have been on duty since the beginning of the escalation for over 30 days, they are absolutely traumatized because first they have been under on duty up to this moment without even getting the chance to go back to their families, to see their families who have lost them with no food, no water, no electricity, and on top of that, under intense bombardments. Our paramedics and doctors and nurses are in extreme fear and concern of losing their families who have left them in their homes, and now they are continue providing their life-saving services. They are completely traumatized because every single day they are encountered to horrific scenes of children and women who have been killed and bombed while they were sleeping in their homes. They are completely heartbroken, exhausted, and distressed out. On top of that, they have lost their colleagues already, because I said 4 colleagues were killed, but our paramedics, our teams there still have the strength and determination to go out and save other people's life, although they are endangering their life, because working as a paramedic or a doctor or a nurse or whatsoever, all healthcare workers are endangering their lives in order to save other people's life. There is no safe place in Gaza. We're talking about attacking hospitals, ambulances, healthcare workers. So basically, all of healthcare workers and the humanitarians are now completely stressed out and traumatized because of this ongoing escalation that have affected every human being in Gaza.
Thank you very much for this discussion.
Thank you. Thanks for having me.